be like a good thing to cover is like, with like Kaleida's transition to Epic, and Catholic Health already, obviously made that transition. I guess like, so the people that reached out to me and like were asking like, what does this mean for HealthyLink? Is there like a key difference you would kind of explain to people of like, what the kind of services that like an Epic provides versus what HealthyLink does? Because I think people see clinical information exchange, electronic health record, and they're,
So it plays over a little bit.
It all sounds the same.
It all sounds the same. And rightly, I understand that. Yes, there is a difference, right? And I in the letter to the editor, I talked about, we applaud this because within Kaleida there are a lot of different systems, as you pointed out in the article, right? And bringing those together, it's important for that health system, right, to make sure that there's the data flows seamlessly throughout the organization. What we do is connect that data to the rest of the community, right? So that's the beauty, the magic of health information exchange. And there's more that we can do as we aggregate the data from across the community from a population health standpoint. So, So just to get back to there are nearly 40 electronic medical record products in this community with doctors using. So Epic is one of many. They're big and they're good. This is I don't want to give anybody the impression that we're competing in any way with Epic. I think it's great that they're here, that those products that have been proven are being utilized, but we have a different function than simply connecting between Epic sites, right? There is care everywhere that allows for the data to flow from, when Kaleida's up, from Kaleida to Catholic and back, but it is not pushed. It's you have to do a query, which is, in some ways what we're doing. We have today, there are on a monthly basis between 400,000 and 500,000 queries to HealthyLink, which results in over 1 million reports opened. And some of those get pushed right into their EMR, right? So they say, Dr. John looks up his patient Dan, looks at a lab result and said, this is interesting, I want to make this part of my record in my EMR, so they can push it right into their EMR. So yeah, I think this is a good thing for the community, but it does not, in my mind, honestly, if it did solve all the issues, I'd say let's find something else to do. I'm not here to try and save HealthyLink for the sake of saving HealthyLink. That's not, it never has been our intention. It's to bring value over and above what's already in here and available in the community, right? This is, and I firmly believe that we bring extreme value, and some of it's not, it's hidden. It's hidden value, right? And that's part of my challenge is to make sure folks know that, if we just turn the switch off on HealthyLink, what wouldn't happen? Reports wouldn't get delivered from labs to the provider's office into their EMR. They're going to be going back to printing those labs and faxing them, right? This is one of those kind of things people just forget about. So, and as we look at, so we've evolved over time from the transaction, the point of care, lookup, that was our early use case, right? We transitioned to, and we stood up a population health tool, we call it Healthy Outcomes. And the result of that is Healthy Western New York, which you did a nice article for us on that. But bringing in claims data was a big part of, enhancing the analytics capabilities that we have. Now, I will say this, I would defy anybody to say they have a better ability to measure patient quality of care, gaps in care, than we do. And it's not because we're smarter than everybody else. It's not because our tool necessarily is better. We have the data. And we've been entrusted with that data to do, the things that are in the best interest of the community.